Judy, I really appreciate getting a few minutes to spend with you and to kind of go over your journey with your particular kind of nerve pain with us. We first met a little bit over 18, 19 months ago. And at that time, you had quite a number of years, 15, 20 years of pain in your right thigh. Can you tell us a little bit about the kinds of things that you were experiencing and what was going on?
Yeah, it first began with just a little numbness on my right leg above my knee that didn't affect my life much at all. And over the years, it just progressed to the point where I would leave the house to go walk, and I'd have to turn around and come back because of the awful pain in my leg, the electrical shocks, running up and down, and just tingling so bad it made it feel like it was hot. Just couldn't do anything anymore, really. Stand in the kitchen for just to prepare dinner, and it was having to put my leg up on a stool to relieve the pressure or whatever. It just affected my life too much.
Yeah.
And so I looked into finding a way to get it fixed.
Yep. And so to be clear, this was in the right kind of thigh up to the
Mhm.
knee area.
Towards
You
the outer thigh,
had,
starting from the middle thigh towards the outer thigh.
yeah. And you had seen a number of doctors. They'd done all sorts of MRIs and injections, and you tried a whole number of medications over the years, and none of that had worked. So eventually, you came to me, and we figured out that it could be a nerve because we numbed the nerve that is responsible for sensation in that area. And that actually provided you some relief for a few hours. So that was a diagnostic nerve block, as we call it. So we did a decompression and we added a little bit of fat around the nerve to help cushion it. And that was about 18 or 17 months ago. And then, as I recall, please correct me if I'm wrong, you got about 60% better. The volume of the pain was less, although it was still there. The numbness was less problematic. You had a slightly increased ability to, perform all the activities you wanted to do. And so we waited a few more months, but then ultimately, or actually, I think we waited about a year. And so 6 months ago, we added a little bit more fat. We did a little fat grafting to add a little bit more cushioning and to bring in some stem cells to the nerves. Can you tell me a little bit about that second procedure? What was the recovery from that like?
Oh,
Pain, a lot of inactivity.
not at all. uh, Even with the first procedure, the post-op was, relatively nothing. I was walking and doing daily things, maybe, just the discomfort of having a bandage over it,
Mhm.
there, but really no pain at all. I never took any of the prescribed medications or anything. So um, recovery was very easily accepted. Yeah.
Great. And so at the end of the day, here we are, about 12 months or 18 months or 17 months from the first operation, and about 6 months from the fat grafting, the additional fat grafting. Where do things stand today? How are you doing?
It's not the main focus of my life anymore. I can actually get through a day and not even think, oh yeah, my leg. Um, on occasion, it'll flare up if I think overextended in term, not my leg, but standing or walking too much. It'll do some tingling and all that, but not like it did before.
Right.
No,
And those shocks and
they
zap.
they haven't occurred.
Yeah.
Um,
So I think you said before when we were talking at one point you were about 90% better,
yeah,
which is
yeah.
great.
I
So
I mean, there's still a little numbness that I'm almost thinking because of the length of time I went without seeking help. Uh,
yeah, it's about
it might
15,
have
20 years.
it was years, yeah,
Yeah.
and that might have just done too much damage. I don't know,
Yeah, I
but
think
to
that's
get this much relief, um, is a blessing. It really is.
Yeah. Well, listen, I'm so glad you've done so well. I always love to help good people. I really appreciate you sharing your story and your journey with us, and obviously wish you the best of luck moving forward.
Well, thank you. You've been great, and I appreciate the time you always took and listened. And um, yeah, thank you for fixing me.
No worries. Thank you so much for taking the time again. Cheers.
Thank you. Bye bye.
Bye bye.